Hello, my dear friends. So today we are going to deal with the part 2 of this question paper. Okay, category 238 bar 2015. Okay, so question number 51. The lines that are seen clearly in longitudinal ground sections of enamel viewed by the reflected light are option A gnarled enamel, option B striae of Retzius, option C Hunter-Struger band, and option D perichymata. So what do you think? The lines that are seen clearly in longitudinal ground sections of enamel viewed by the reflected light are option C Hunter-Struger bands. Okay, 51C. Hunter-Struger bands are seen clearly in the longitudinal ground sections of the enamel under reflected light. Okay. Now question number 52. The organic phase in dentine is primarily composed of type 1 collagen, type 5 collagen, type 3 collagen or type 11 collagen. The organic phase in dentine is primarily composed of A. Okay, type 1 collagen. Type 1 collagen. Type 1 collagen is present in the organic phase of the dentine. Now question number 53. The first sign of dentine formation is the appearance of lines of von Ebner or Toombs process or von Kropf fibers or contour lines of Owen. What is the first sign of dentine formation? The first sign of dentine formation is von Kropf fibers. Okay, option C. Von Kropf fibers. The first sign of dentine formation is the appearance of von Kropf fibers. Question number 54. The principal cell in the lamina propria of gingiva is endothelial cell or mucous cell or histiocyte or a fibroblast. Question is very easy. The principal cell in the lamina propria means the gingiva. Okay, the lamina propria of the connective tissue part. Okay, connective tissue part of the gingiva is mainly the fibroblast. Okay, fibroblast. Option D. Question number 55. The earliest histological indication of tooth development is at the 6th week of embryogenesis or 2nd week of embryogenesis or 4th week of embryogenesis or 3rd week of embryogenesis. The earliest histological indication of the tooth development is at the 2nd week of embryogenesis. Okay, so how do you see histologically? At what time? 2nd week of embryogenesis. Okay, 2nd week of embryogenesis, you can histologically see the tooth development under the microscope. Now question number 56. The accurate radiograph for the diagnosis of proximal caries lesions when a contact point is present is. So what do you take? If you have a caries in mesial or distal aspect, which radiograph do you recommend for the patient? Option A occlusal or RVG or bite wing or intraoral periapical radiograph. So which one do you recommend? Mainly bite wing radiograph. Okay, it's very easy. Bite wing is recommended for proximal caries. Question number 57. A restoration material that will set in the dark is compomer or resin modified GIC or nanofilter composite or Pitt and Fisher sealant. Which restorative material requires a darkness? Okay, set in the dark. Option B, resin modified GIC. Okay, 57B, resin modified GIC requires a darkness. Okay, it sets in the dark. Question number 58. IPS Empress 2 is an example of injection molded ceramic or CAD-CAM ceramic or sintered ceramic or glass infiltrated ceramic. IPS Empress 2 is an example of injection molded ceramic. 58A. Injection molded ceramic. IPS Empress 2 is an example of injection molded ceramic. Question number 59. Okay, let's move on to question number 59. Okay, I hope all the questions till now is clear for everyone. If you have any doubts, please comment below the video so that we can give you the explanation. Okay, question number 59. In the hand instrument formula, the first number indicates what? So if you get the instrument, you will see the instrument number on the instrument, isn't it? So the hand instrument formula, the first number indicates what? A, the length of the primary cutting edge in tenths of a millimeter, or whether it indicates the width of the primary cutting edge, or whether it indicates the width of primary edge in tenths of the millimeter. The option B is telling hundredths of a millimeter. Option C is telling tenths of a millimeter. And last option is again asking you whether it is telling about the length of the primary cutting edge in hundreds of the millimeter. So first clear out whether the first number in a hand instrument formula is indicating length or width of the instrument. Surely it indicates the width of the instrument, okay, of the primary cutting edge. Now option B or option C is the confusion. It indicates the width of the primary cutting edge in the tens of the millimeter. Okay, so option C is the correct answer. The hand instrument formula, the first number is indicating the width of the primary cutting edge in tens of the millimeter. Option C. Question number 60. Ditch cut is usually employed in which technique? Lamination technique or Keller-Lilly preparation for composites, or primary flare for indirect cast restoration, or proximal preparation for amalgam. Ditch cut is usually employed in mainly proximal preparations for amalgam. Okay, so ditch cut is mainly given in amalgam preparations. Okay, proximal preparations of the amalgam. 60D. 61. Which is the most common odontogenic cyst being reported? Dentigerous or odontogenic keratocyst or OKC, periapical cyst or gingival cyst. Most of the time the patient comes with a periapical cyst. Okay, you take a intraoral OP and what do you find? A periapical cyst. Most common odontogenic cyst reported. 61C. 62. Tulip shaped crown is a feature of which of the following condition? Turner's hypoplasia, toroidontism, dentinogenesis imperfecta or dentin dysplasia. Tulip shaped crown is the feature in dentinogenesis imperfecta. Tulip shaped crown is a feature in dentinogenesis imperfecta. Don't get confused with amelogenesis imperfecta. It is dentinogenesis imperfecta. Now coming on to question number 63. Which of the following is the commonest intraoral site for mucoepidermoid carcinoma? Mucoepidermoid carcinoma is a salivary gland carcinoma. So which is the most common site? Buccal mucosa or floor of the mouth or palate or labial mucosa? Mucoepidermoid carcinoma is mostly seen in the palate region. C. There will be minor salivary glands in the palate. So in the palate do you find mucoepidermoid carcinoma most often. Okay. 64. Burnished dentine is initial dental caries or arrested dentinal caries or advanced dentinal caries or necrotic dentine. Burnished dentine is actually what? Arrested dentinal caries. Option B. Burnished dentine is arrested dentinal caries. You will see dark black in color. Now question number 65. Driven snow appearance in radiograph is seen in Pinbock tumor or ameloblastoma, cementoma or adenoameloblastoma. Driven snow appearance is seen in Pinbock tumor. 65A. Number of bones present in an infant skull, 44 or 45, 46 or 40. How many bones are present in an infant skull? 45. Okay, 45. 66B. 45 bones are present in an infant skull. Optimum orthodontic force in grams per centimeter square is actually 20 to 26 or 30 to 35 or 50 to 56 or 50 to 100. So optimum, okay, stressing the word optimum. Optimum orthodontic force is 20 to 26. 67A. 20 to 26. Okay. Coming on to question number 68. Now I am again repeating, if you have any doubts you can comment below the video. We will give you individual reply. Okay. So don't get tensed or confused about the exam. If you have any doubts regarding any of the topics, please comment down below the video. Okay. Question number 68. Which among the following is not an example of second messenger involved in tooth movement? Cyclic AMP or inositol phosphate or cyclic GMP or prostaglandins? Which among the following is not an example? Okay, so you have to stressing the word not an example of second messenger. Okay, not a second messenger. Prostaglandin is not a second messenger. 68D. Prostaglandin is not a second messenger in tooth movement. Okay. Cyclic AMP, inositol phosphate, cyclic GMP, all these are second messengers. 69. Deck-Biss malocclusion is seen in which of the condition? Class 1 bimaxillary protrusion, Class 2 division 1, Class 2 division 2, Class 3 malocclusion. Deck-Biss malocclusion is seen in Class 2 division 2. Option C. Class 2 division 2. Deck-Biss malocclusion is seen in Class 2 division 2. Question number 70. Class 6 of Ellis and Davy classification of tooth fracture is avulsion, A fracture of root with or without the loss of crown fracture, displacement of the tooth or non-vital tooth. Class 6 is root fracture. So option B. Okay. Okay, did I miss one question? Question number 70, isn't it? Sorry. Reverse orthodontics is the term used in interceptive orthodontics or preventive orthodontics, camouflage treatment or surgical orthodontics. Reverse orthodontics is the term used in surgical orthodontics. Okay, 70D, surgical orthodontics. Now question number 71, as I said, class 6 of Ellis and Davis classification is fracture of the root. Okay, option B. 72. External root resorption due to infected pulp is inflammatory resorption or surface resorption or replacement resorption or osseous resorption. External root resorption due to an infected pulp is actually an inflammatory process. So inflammatory resorption. 72A. 73. Objective test of assessing pulp vitality is cold test or electric pulp test or pulse oximetry test or test cavity test. Objective test of assessing pulp vitality is actually a pulp oximetry test have to be done. It is an objective test, okay, not a subjective test. Pulse oximetry test. 73C. 74. Preservation pulpotomy is empty pulpotomy or calcium hydroxide pulpotomy or formocresol pulpotomy or ferric sulfate pulpotomy. Preservation pulpotomy is ferric sulfate pulpotomy. 74D. Ferric sulfate pulpotomy. Preservation pulpotomy is ferric sulfate pulpotomy. 75. Fixed space maintainer used where deciduous second molar is prematurely extracted prior to the eruption of the permanent first molar is. So which is the fixed space maintainer used in case of a deciduous second molar extraction before the eruption of permanent first molar? Which is the fixed space maintainer? Options are Banton loop, distal shoe, lingual arch, transpalatal. 75B. Distal shoe. Okay, distal shoe is actually a fixed space maintainer used where the deciduous second molar is prematurely extracted prior to the eruption of the permanent first molar. So you have to use a distal shoe space maintainer. Okay, coming on to question number 76. Okay, ready? Question number 76. Multiple fibromas of the face can be seen in which syndrome? Gorlin-Gall syndrome, Cowden syndrome, Albright syndrome or Gardner syndrome. Multiple fibromas of the face can be seen in B. Cowden syndrome. Okay, multiple fibromas of the face can be seen in option B. Cowden's syndrome. Okay. Question number 77. A reddish to purple discoloration of the skin or the mucous membrane of size 0.4 to 0.9 centimeter caused by the blood from vessels leaking into the connective tissue is called petechiae or ecchymosis or purpura or hemangioma. What is the reddish to purple discoloration of the skin, and the size of this discoloration is given as 0.4 to 0.9 centimeter. This is due to the leakage of blood from the vessels into the connective tissue. This is called as what? Purpura. The size of the lesion you have to consider, it is purpura, 0.4 to 0.9 centimeters. So it is purpura. Okay. 78. Hardener used in a fixer solution is ammonium sulfate or benzotriazole, aluminum sulfate or sodium sulfate. Which is the hardener used in a fixer solution? 78. C. Aluminum sulfate. Aluminum sulfate is the hardener used in fixer solution. Aluminum sulfate. Okay, question number 79. The ability of a radiograph to define an edge precisely is called film sensitivity or film sharpness or film contrast or film resolution. The ability of a radiograph to define an edge precisely is called the film sharpness, the sharpness of the film. Okay, option B, film sharpness. The ability of a radiograph to define the edge precisely is called the film sharpness. Question number 80. What is the SI unit of radiation exposure? Coulomb per kilogram. Okay, the SI unit of radiation exposure. Question, please concentrate on the question. They are asking radiation exposure. Okay, exposure, Coulomb per kilogram. Okay, question number 80A. Question number 81. Which is a non-operating dental auxiliary? Dental laboratory technician or dental therapist or dental hygienist or expanded function dental auxiliary. Who is non-operating? Of course, a technician is not a operating auxiliary, isn't it? So dental laboratory technician, 81A. 82. Which is not a property of normal curve? Bell shape, mean is 0 and standard deviation is 1. Mean median mode coincide, mean is 1 and standard deviation is 0. Which is not a property of normal curve? Okay, bell shape or mean is 0 and standard deviation is 1. Mean median mode coincides, mean is 1 and standard deviation is 0. Of course, 82D, mean is 1 and standard deviation cannot be 0. This is not a property of a normal curve. Okay, 82D. 83. Example of an irreversible index. Low and Silness gingival index, DMFT index, oral hygiene index, none of the above. Which cannot be reversed? Irreversible index. DMFT index is irreversible. It cannot be reversed by treatment. DMFT. Okay. Okay. So we have completed up to 83. Now let's move on to 84. Safety tolerated dose of fluoride. Safety tolerated dose of a fluoride, 4 to 8 milligrams of fluoride per kg body weight, 8 to 16 milligrams of fluoride per kg body weight, 16 to 32 milligram of fluoride per kg body weight, or 32 to 64 milligram of fluoride per kg body weight. Safety tolerated dose of the fluoride is actually B, 8 to 16 milligram of fluoride per kg body weight. Okay, safety tolerated dose of a fluoride is 8 to 16 milligrams of fluoride per kg body weight. Okay, so let's discuss the last question of the day, which is not true for cohort study as compared to case control study. Expensive, proceeds from cause to effect, unsuitable for study of rare diseases, yields results quickly, which is not true for cohort study. Okay, 85D, yields results quickly. Okay, cohort study does not give you results quickly compared to case control study. Cohort study takes a long time duration to give you results. Okay, so that is not true. Clear? It is expensive. Yeah, cohort study is expensive. It proceeds from cause to effect. It is unsuitable for study of rare diseases, and it doesn't give you results quickly. Okay, so that is about the cohort study and case study difference. So rest of the questions we'll be dealing with the part 3 tomorrow. So revise these questions. The revision is more important. Okay, so revision is very, very important. This question paper is very important. You may not get the question paper everywhere. So this is the exact question paper of category 238/2015, appeared in the year 2015. Okay, so please do check out the question paper again and again. After this question paper, we will be dealing with the next previous year's question papers. Okay, thank you. Subscribe to the channel and please click the like button if you want more such videos. Thank you.